Just like I fit in with a Delta. What's the difference? Can you tell me the difference?
Miss Hill, what's the word to you?
You know, she's a Delta.
Oh, my grandma is Delta. My mama is Beta. Coach Thomas at AKA.
She is? I don't know why she act like that. Oh my God. When you go to college, you just go and you just see what's happening and you decide. I watch videos.
I think I want to be in Fail 4. That's what she should be. It's like a hip hop.
What she say?
Fail 4 at ASU. I'm supposed to be doing hip hop dancing.
All right, let's go over the bell room. I can't see us today. I can't see us today. All right. For adults, each one person needs to move the chest at least what? How many inches?
2 inches and 5 centimeters.
2 inches, 5 centimeters for adults. Once we get to pediatrics and all that, we'll learn what that is. But for adults, that's 2 inches or 5 centimeters. Rescuers should limit interruptions to chest compressions to less than how many seconds? 10 seconds. Everything you do, check and pause, look for breathing, whatever you got to do, needs to be no longer than 10 seconds because you start CPR or chest compressions as soon as possible. With 2 rescuers, how often should you switch compression rolls? Every 2 minutes or 5 cycles. So it'll be 5 cycles of 30 to 2. You'll do that 5 times, that's about 2 minutes. When starting chest compression on an adult, you should put the heel of one hand in the center of the victim's chest on the what part of the sternum? What part of the sternum? Nobody knows.
The middle of the stomach.
No, not middle. Side. Why is what did I say?
Goodbye.
I know, that's why I picked it up and I'm good. I keep calling about that card warranty. Alright. So this is your sternum, right? Your breastbone, your sternum. So if I'm doing chest compressions, where is my hand?
On the lower chest? The lower stomach? The lower of the
lower part, like lower half of the sternum. So this is your sternum and your hand is here. That's the lower part, right? So it's gonna be the lower half of the sternum. That's where your
lower half.
Oh, lower. I just said she said lower. Lower.
God, Alicia.
I think it's you with the speech problem, not us. I actually had a speech problem in elementary school. I had to go to the lady because she wouldn't never buy no chips. A speech therapist? Yeah, something like that. Okay. Cause I could always say, I used to stutter a lot. I do it sometimes too, but people don't catch me for real. And I used to like squeak, heat barbecue chips. I never could say sweet. I could never say shrimp right or nothing. Wrong people that can't say shrimp.
You say scrump.
No, I say shrimp.
You say scrump.
Oh, I know.
Yes, you do.
All right, so it's the lower half of the sternum. That's what you put in your hand. Chest compression. The 30 chest compression should be at a rate of what? How fast? What's the name of that song? 100 to 120 beats per minute. That's how fast you should go.
You said 120 to
100 to 120. So you should be able to do per minute. You should be able to do at least 100 compressions, or you can go up until 120. So remember the beat. Staying Alive, also Crazy in Love. The difference always got to be about how fast you go.
Listen, can I get a look at the quiz so I can study for it?
No. You all looking at the quiz, you're doing your bell ringer. I'm about to go over the last of these notes.
I told you she said the bell ringer must be good. You didn't tell me that. Why not?
9 seconds, 10.
So I already know what type of question she gonna try to put on it.
Okay.
You. You, the kale. It's on cardiac arrest?
It's on adult CPR. Don't be honest.
And if I fail, I know who to come to.
Who? Tonight?
Miss Perry.
You gonna come to me for what now?
If I fail, I know who to come to.
If you fail what?
My quiz. You can't come here because she said the reminder.
I said the reminder, I put notes on school to deal, they all that.
Oh, for them notes that's on the thing?
That's everything we've been going over.
On what?
On school to be.
Wait, I did look over. I ain't gonna tell you I did. I was looking at it, Mr. Adams. Yes, she was. Today. Now, you know I heard.
This is the stuff we've been talking about going over.
Okay, so I should know it then.
Nope, she don't got it. I got to look my bearings. I'm talking about today. What you been doing?
Oh, I still didn't sign up for AES. AES. That's what I did do.
Alright, we didn't finish AED, I don't think.
Using an AED for adults.
Alright, so we kind of talked about AED the other day. What does the AED stand for? Y'all remember? What's the A stand for?
Adult.
Automated
emergency. What AED? They're gonna be on the quiz too,
no, it's not gonna be on. I'm asking y'all know what it stands for. Automated external. What's the D stand for?
That's gonna be on the quiz.
Defibrillator. So, what you should know what it stands for. So it's automated external defibrillator because it's external because it's on the outside. You're putting the pads on the outside on the body. So we talked about how I keep forgetting to bring the one that's at my house. Yeah, because once I get home, everything is going to my head. Once I sit down. Okay. No, you don't go through my head. I say everything. I say everybody. Unless I put it in grade, then I'll be like, oh, look what's got. I'll put it in zero. I told my first period, I hope y'all know I dropped zero last night. Did Schoolsy update for, not Schoolsy, Power School?
No.
I think I put nothing in for y'all.
Our grade went down. Well, you do point out a 7 again. Who was we?
I'm not going to say that one. Did we give you a notification? Yeah. You know why I like Power School? It'll tell you when your grade go up, when your grade go down.
Baby, my grade was, my grade still the same. No, it's the same. I still got an 8 or 9. You must ain't put grades in.
All y'all stuff current. She just did her hand washing, so I put hers in. Oh. So hers went up. Y'all gonna get a grade today. They're gonna update. It's gonna update today. Alright, so when you have an AED, remember what's the first thing I told you I had to do?
You gotta power it. You gotta turn it on.
You gotta turn it on because if you don't turn it on, it's not going to tell you what to do. It's a machine that's made to tell you what to do, so you have to turn it on so you can hear what it says. So it's foolproof. So for adults and children 8 years and older, you'll use, I guess they're saying you can use the AED for like adult, because remember they have different pads.
Only gave me class 24.
So you have different pads for the AEDs. You'll have adult. I don't have my pediatric pad. It might be in my truck. I'll look when we come back from the next room. So it tells you like it has pictures on it, so it's gonna tell you exactly like where you place the pad. So it's like foolproof. So it'll tell you where. So if I was put one on Sanaya, this one on her left side or right side will go here, and then on her left side will go like under her arm up down here. So
you remember the video playing, and I was like, "This picture thing on."
So they have adult pads, and they also have children's or pediatric pads. I think these are adult. Yep. All right, so you attach the pad, you allow the AED to analyze the heart rhythm, you'll deliver a shock if advised. Then you'll immediately restart chest compression. After the shock, a lot of times we'll check the pulse to see if the shock brought the pulse back. But the AED will tell you to resume CPR, so it tells you all that stuff. So it analyzes or reanalyzes every 2 minutes. So you're not gonna be able to just keep hitting the shock button because it's not gonna shock. It's only gonna shock if it feels the need to shock. All right. So once you get the AED, you're gonna be positioned at the patient's side, and whoever's operating it should be right next to it. For a 2-person rescue, this is the rescue who is not providing chest compression. So if you're not doing chest compressions, you'll be the one if it's 2 people that's working the AED. This allows the AED to be set up and operated with minimal interruption to chest compression. Because remember, chest compressions we don't want to interrupt for long periods of time. Some AED models have a cover and power on automatically when the cover is open. The AED does not power on automatically, turn it on manually. Then you'll just follow the voice prompts.
Step 2.
So you'll attach the pads, like on this picture here, it's showing you got one on the right side that's upper chest, and then kind of over here, like on the left side. So you'll just put them, you gotta make sure you have a bare chest, so you need to make sure that it's open. You can't put the pads on top of clothing. So some AEDs provide adult pads, some provide child pads. So to use adult pads, you'll use anybody that's age 8 and above. You don't want to use the child pads because they're not large enough to deliver the shock that's needed. And then it's opposite with the children's pads. You can't use them on the adult because they're not going to give what you need. Sometimes you can, if you don't have anything else, you can use the adult pads on a kid or a pediatric or infant or whatever, but you got to make sure that the pads, they're smaller people, little people. So you got to make sure that these 2 pads aren't touching. Because if they touch each other, they can deliver a shock that's too big for a baby or, a little kid's body. So it just depends on the AED model. Some of them, everything is basically already attached. If not, you'll have to attach it. For a 2-person rescue, one rescuer should set up the AED while the other provides chest compression. So, like I said, chest compressions are more important. Airway, or breathing, not as much until you get like the AED on, because you need that. You want to need that to deliver the shocks.
Step 3.
All right, so then you're going to allow the AED to analyze the heart rhythm. Some AEDs will prompt the operator to push a button to start analyzing the heart rhythm, while others will do so automatically. Regardless, when the analysis starts, no one should touch the victim. If anyone is touching the victim, a faulty analysis may occur. So when it tells you analyzing heart rhythm, that's usually what it says. Don't touch the patient, because you want to make sure that it's giving an accurate analysis, so that if it's right, it's going to shock if it's supposed. You can shock if it's supposed to. If multiple rescuers are present when the AED prompts and analysis is starting, the AED operator should loudly give a clear victim message, such as stand clear or simply clear. We usually say clear. That means everybody back away from the bed or the patient. Don't touch anything because we're about to deliver a shock. But the thing is, sometimes in like emergency situations, is a lot of people in the room, so you got to be kind of loud when you're saying clear so everybody can hear you. Sometimes, like, I'll just be like, hey, you're gonna get shot, you better move back, like if they don't move immediately,
All rescuers should use closed loop communication to indicate they are clear of the victim by responding with clear and holding their hands up. Most people just kind of just go back like this, and then once they deliver the shock, then we go back to what we're doing.
Step 4, deliver.
All right, so the next step is to deliver a shock. If the rhythm is shockable, so what 2 rhythms are shockable? Y'all remember? V fib and V tech. Those are the 2 that are shockable. What's the one I told you that's not shockable? Huh? Flatline, and the word for flatline is what? So that's what A. Asystole. Asystole means flatline. So if it's shockable, it will shock. It'll tell you deliver shock. If it's not shockable, it'll say resume compressions, because that means it's not going to give a shock. So when this occurs, compression should stop and no one should touch the victim. If anyone is touching the victim, they could be injured when the shock is given. If multiple rescuers are present when the AD prompts to shock the victim, the AD operator should loudly give a clear victim message. Again, all rescuers should use closed loop communications to indicate that they are clear of the vicinity by responding with clear and holding their hands up. AD operator should make sure everyone is clear and then press the shock button on the AD. The shock will create a sudden contraction of the victim's muscles, so they'll kind of like contract. I'm gonna see if I can find a video so y'all can see.
Step 5.
While y'all eat lunch. All right, so step 5, you'll immediately restart chest compressions. Once the shock has been delivered, or if no shock was recommended, CPR should be restarted immediately with chest compressions. In general, CPR and specifically chest compressions should be performed whenever the AD is not analyzing heart rhythm or delivering a shock. So anytime if it's analyzing, you're not going to do chest compressions. If it's delivering a shock, you're not going to do chest compressions. But any other time, you're going to do chest compressions. So if you're the one that's setting up the AD, your partner is doing compressions, you have to work around them because you don't want to stop the chest compressions for any amount of time.
Step 6, repeat.
Step 6 is repeat rhythm analysis when prompted by the AD. After,
That's a real person?
yeah, with the AD pass on you. I'm sure they're not going to shock him, but yeah, that's a real person. After about 2 minutes or 5 cycles, the AD will prompt the rescuer to perform another heart rhythm analysis, thus repeating the previous steps. This sequence of CPR and AD usage should continue until, so these are reasons why, I think that might be on your quiz, reasons why you should stop CPR. If the victim shows signs of ROSC, y'all remember what ROSC stands for? Huh? R stands for return of spontaneous circulation. So what that means is they have a heart rate or they're, breathing. Circulation is their heart starts beating. So signs of ROSC are coughing, because if they're coughing, they're going to start moving there. If they're coughing, they should have a heartbeat. Normal breathing or movement. Another reason why you should stop CPR, care is transferred to an advanced life support team. So say you're out somewhere, had to call 911, you start CPR, then EMS comes. That's the only reason you're going to stop and they're going to start or continue it. Rescuers are unable to continue because of exhaustion or the scene becomes unsafe. Like if you're the only person there and you've been working for minutes, then you might have to stop. If you have no help because you're gonna be exhausted. Remember, the longer you go without a break, your chest compressions aren't gonna be as effective. Or something happens, people shooting, fire, something. If it's unsafe, then it should stop. And then if they bring, this means a valid documentation stating that resuscitation should be stopped. That's a DNR order, do not resuscitate order. If somebody brings that, then you'll stop. We've had this happen at the hospital. They brought somebody from home or brought somebody from nursing home, and they'll get there on the ambulance and they're just like cardiac arrest. So we start doing it, and then they'll bring a document because we can't just be like, oh, I wonder if she's a DNR or she might be a DNR. We got to go ahead and get started. Then if they come in with the document, then we'll just stop because they have that order saying they don't want any kind of heroic efforts
Special conditions.
All right, so special conditions that might require the rescue to take additional action when placing AED pads on a victim. So if they have a hairy chest, pacemakers or implanted defibrillators, transdermal medical patches, water covering the chest, or flammable material nearby. So if they're hairy, those pads might not stick. It happens all the time when they're in the hospital and we have to put them on a monitor with the little EKG things. They're too hairy. They're not sticking. So in an emergency situation, what you can do is, say for example, you have one of these, this has more pads in it, like a pack of pads. You can take one of the pads and you can put it on, you can rip the hair off. Just over where you need to put the pad.
They gonna feel it?
Yeah, he's almost with Jesus. He ain't gonna feel that. He is not gonna feel that. I would not be concerned about his hairy chest. He'll be manscaped when he woke up. I mean, we've had to shave beards and mustaches before to get stuff done. Like when they're intubated and we tape that tube, like hair, sometimes the tube, because it's like sticking like this, it won't stick. So we'll have to like shave a little bit so that it'll stick. I mean, it's hair to go back. So if you can't, sometimes if you have, like if you're somewhere else, they might have because you can make your own little kit to go with your AD. They might have a little razor or something, but if you don't have a razor, this is your best bet. Just take it, rip the hair off, so you can make sure, because you want to try to save their life, so you want everything to work. All this hair is not gonna work. They might have an implanted defibrillator. So I don't know if you've ever seen pacemakers. So this is the left side. It's like a little bulge up under the skin because it's an actual little round device that they place under the skin. You would not put the pad directly on top of it. You would move it so it's not right on top of it. You still want to use it, but you don't want to put it. But you'll see it. It's really coming out of the skin. My daughter, the 16-year-old that has seizures, she has an implant. It's not a pacemaker, but it's called a VNS. Is a vagal nerve stimulator. So it looks like a pacemaker, and it has a little lead that wraps around her vagus nerve, and it goes off like every, I can't remember what it said, at 5 minutes, and it kind of gives like little shocks to try to help with her seizures. And when she actually goes into a seizure, it has like a little magnet. You can wear it like, it kind of looks like an Apple Watch. It's a magnet though. It's like on a little band. We keep one on her chair, her wheelchair that she goes to school with, and then my mama keeps one on her refrigerator, and then I keep one at on my nightstand, because like when she has a seizure, if you swipe it, like make an X over it, it can it'll ramp up and it should stop her from having a seizure. But the thing is, her seizures are so fast sometimes. By the time I run to get the magnet, she's out of the seizure. So it's aggravating, but. I don't never really get like, what y'all can, because my seniors be like, you so nonchalant. I don't never really get worked up about anything. Like my nurses knew if I got worked up, it was a problem. They'd be like, oh yeah, you walking fast, what's wrong? But like a couple weeks ago, I don't think I told y'all, because I think I'm gonna talk about 12th grade. I've been beefing with Walgreens for like the last month because I don't know, what their service has been horrible. Well, she has medicine that she takes every day for her seizures, and I was having a hard time getting her medicine, so we ran out of one of her medicines, and I had been calling. I stayed on the phone on hold one time here on my planning period for an hour and 15 minutes trying to get somebody on the phone about her medicine, and one of her medicines that ran out, so she was without one of her medicines. Well, she went into, it's called status epilepticus, is when they have like a long seizure. She has a seizure over 5 minutes. We're supposed to give her some different kind of medicine. Well, we gave her that, it was one Monday, I think, came home, my husband was there. She started going to a seizure. So he's like, he was in the room with her. I didn't even know. I was in the other room. I was on the phone with Walgreens trying to get him on the phone again. And he was like, she having a seizure, get the magnet. So I got the magnet. No, he said, get the medicine. So I got the medicine, and we gave it to her. Usually it stops it. Well, it didn't stop it. So then we were swiping the magnet wasn't going. She was in that seizure over 20 minutes. We've never had a seizure. Like, I'm sweating at this point because I don't never get worked up. And I was like, yeah, we got to go to the hospital. So luckily we live very close to East Alabama, like 5 minutes. So like my husband's coming over the front yard. He done bagged the truck up, and I'm like trying to get stuff.
So while y'all was doing all this, she was still in seizure?
Yes, she was still in seizure. Like he had got picked her up and he put her in the truck and he strapped her in so she couldn't like hurt herself. So I'm getting Jordan. I'm like, Jordan, put your shoes on, grab this. She was supposed to go to tumbling. It's just the too much is going on. And then I'm hot. I'm just like, and so then I jump in the back seat with her. He throw her chair on the back of the truck. And so we take off to the hospital. His thing, he has this thing on, he has this thing on the back here that covers his bed. It goes flying off the back of the truck. I'm looking at like, what was that? It just went, I said, oh, I hope it didn't hit nobody because we stopped. We kept going. It was probably about 8 o'clock before we got back there to get it. So we get to the hospital. As soon as we pull up, she like kind of comes out of it. Like I'm sweating in the back seat because I'm holding her. I'm like, oh my God, what is happening? Like we've never in 16 years has she ever done that before. Jordan, she crying, she upset. I'm just trying to keep it together. So then we get into, then we pull up, and my piano player, he works at the hospital as like security. And so I didn't know who my husband was talking to. He just threw the door open. He's like, hey, we need a wheelchair. And I'm like, who are you talking to? And it was him. So he went and got a wheelchair and put it in. By this time, she stopped. So we get inside the ER, and I just tell them what happened. So they get our information, whatever. So we sitting there, and I start looking at all those people in there.
They ain't trying to rush you to the bed?
No. So I started looking at all them people now. Y'all know I'm a germaphobe, so I'm looking, and then they called us to triage, and they took our vitals, and I just explained. And I was like, well, she's out of it, but she 20 minutes, like we've never had her before. Okay, well, we'll get you back soon. I texted my husband, I said, bring the truck around. I texted him, and I said, you out there? He's like, yes, I'll wheel her out, and I'll get her, and I go back. I said, yeah, we leaving. What y'all want me to do with this wheelchair? I said, we'll call the doctor. I wasn't going to stay in there with all them coughing folks.
They were coughing?
Well, it's COVID bill now. So, but that's the thing, like, I don't never get. But I was a little panicky. That day because she had never done that before. So, but we got a different plan, like I called the doctor, so we got different things to try. I usually do very well. Like, it is. That's why I'm a little crazy. Y'all hadn't noticed, that's probably that's the 16 years of dealing with that. Cause she's had seizures since she was 3 months old. So we've been dealing with this for 16 years.
And it's kind of crazy that God was going to be like a doctor or something and her daddy went. Like, if you think about it.
I don't know. That's what people say, but I be, it be hard. All right, y'all line up. We're going to go left. Let me pause this thing. I know they don't, but we don't go down there. Where my little person go? Oh, it's way up here.
At McDonald's.
Special conditions.
Huh? At McDonald's, I get paid $11.
McDonald's. You act like $11 do something for me. $11 do nothing for me.
It do something for me.
Oh.
It do something for me. The rest of them get paid $8 minimum wage at work. Y'all know nobody $11 an hour yet.
I do.
Where you work at?
Guys.
Five Guys get paid $11?
Yep.
Come on, ready to go out there. I'm not working at no fast food restaurant. Five Guys ain't no fast food restaurant. Where you work at? I ain't got no job. I'm 15. You're 15. What? I'm 15
Why you calling me that?
I know. I was from 05.
Oh. When did 05?
October.
That means you're supposed to be 16.
I'm supposed to be a 10th grade. I'm about to say, you know, man, you're going to be smart. You're still great. No. Yeah. I started school early. Don't forget y'all sandwiches and y'all coaches. She's so bad.
Alright.
You ain't gonna be playing that shit if you keep quitting. You got a whole thing on that shit. Mariah kept playing. Look, they done back every time.
Come on back on here. So you gonna be talking.
They ain't gonna put me on the business shit, so I'm gonna go out like the rest of the girls be going out. They like this for kids. I'm gonna get this. That's what they play. Just come on now, come on. We get this on the road.
You left some crumbs.
No, I put it in my hand.
I'm glad you did. No, I wiped all these tables off for y'all. Came in.
You left crumbs over here, but
Oh my God. You know.
She just nasty. I can put it in my hand. You left these crumbs right here. There's some right there. Bring. I tell her. And all over there. Right there. Right. Oh, you and your water, your cup of water, left a spring of water right here. How many did you get there? I'm not gonna do this. Here, get your scoop out.
I'm just trying to cheat so y'all say they quiz.
She just threatened.
Woo! Alright, so conditions, special condition about people with AD. So we talked about hearing tests, if they got a pacemaker or implant defibrillators. Sometimes they might have a medical patch. So if they have a medical patch, you know, they got those like nicotine patches and it's like a pain patch. You'll like if this little patch, you'll just pull the patch off and it has medicine, so you want to wipe the medicine off. You don't want to put the pad on top of the medicine. If they got water, you know, the AD is an electronic device, so that could, you know, do some bad things. You don't want them to be wet, so you need to dry their chest off. And flammable material. So, the rescuer should observe for these conditions and take appropriate action. So, like I said, if your hair test, you shave or take one of your pads and pull the hair off, pacemaker, or if they have something implanted, you want to still use a pad, but you probably got to deviate just a little bit so that the pad is not directly on top of whatever that device is. Patches, pull the patch off, the medicine patch, and wipe the medicine off the skin. If it's not gonna be anywhere where your AED patch is on, then you don't have to worry about it. But if it's in a place where you have to put the patch, the AED pad, then you need to make sure that it's, you know, nothing right there. And if it's water, wipe the chest off, and it's flammable. Special conditions that do not require additional action. If your patient is pregnant, a victim on a metal surface, and jury or body piercing. In the case of jury or body piercing, these items do not need to be removed. However, avoid placing IV pads directly over any metallic items.
Hair unchecked.
Oh, we done talked about that. So, chest hair rarely interferes with pad placement. However, if they have excessive amounts of hair, it can prevent it from having good contact. So, like I told y'all before lunch, like you quickly remove it. That's shaving, because some razors are included with some ADs. If you can't shave, like I told y'all, you'll take an extra pair of pads and you'll just rip the hair off.
Pacemakers or implants.
So this is what a pacemaker looks like, this little round device. So like I said, you can look and feel for any hard lumps, but normally you can see it like coming, sticking a little bit out of the skin. So you know not to put it directly over that. Yeah, so you'll just try to avoid placing a pad on top of it.
Transdermal medical patch.
So this is what a medical patch looks like. So you'll just pull it off, you'll wipe off the medicine. And
water covering the chest.
So if they have water, if they're in water, like if they're like in some shallow water or a pond or something, and you can get them out, you'll pull them out of the water first. If the chest has water on it, you'll wipe the chest off with something, like if it's got their shirt, because remember you got to get to their bare chest, so you can wipe it with that shirt or something. You don't want to get the AD or the pads wet. It does say if they're in snow or in a small puddle, you don't have to move them. I still would. I know me, like if they were in a puddle, I probably would move them because I don't know. I just be feeling like
flammable material.
So they don't use AD around flammable liquids or combustible materials like gas or free-flowing oxygen.
AED maintenance.
As with any device, routine maintenance of the AD is important to ensure it is in good working order and ready to use when needed. ADs require very little maintenance, but it's important to regularly check them according to the manufacturer's instructions or local protocols. Maintenance may include changing batteries, calibrating the device, and ordering and replacing supplies such as pads, scissors, razors, and wipes. Yeah, you gotta check them because they could stuff over them will be expired like batteries and stuff. So
Lesson summary. In this lesson,
all right, we're gonna look at opioid overdose.
what you'll learn. In this lesson, you'll
All right, so we're gonna learn about what opioids are, understand the dangers of opioid overdoses, recognize opioid overdoses, and know how to treat opioid overdoses in an emergency.
What are opioids?
All right, so opioids are a class of natural and synthetic drugs that affect the nervous system to relieve pain. They can come in tablet, capsule, and liquid form. Some opioids are illegal, such as heroin. Other opioids are legal when prescribed by a doctor, such as oxycodone and morphine. So unless you got a doctor's prescription for them, then you can get in trouble for having them or taking them.
What they do?
What they do? It's a drug. Get you high. It's for pain. But like if you're abusing it, if it's not for something in particular, then you know.
Opioid overdoses.
People, and the thing with overdoses, people take, especially when they don't really have a prescription, they might take too much of something, but they don't know how it works. They just know it makes them high, so they think they take excess amount. Then that's when you start, like, it'll start stopping your respiratory drive, and so once your respiratory drive, that means your breathing stops, then everything else will slow down and stop. Improper use of opioids can lead to physical addiction and overdoses. Opioid overdoses can cause nervous system and respiratory depression, and that means you'll stop breathing. This can lead to respiratory arrest, cardiac arrest, and death. The rate of opioid overdose-related emergency department visits almost doubled between 2005 and 2014. In 2016, over 42,000 people died in the United States due to opioid overdoses. In 2017, the opioid crisis was officially declared a public health emergency in the United States. Because people are abusing it, so they're not taking it the way it should be taken.
Quick treatment with naloxone.
As the opioid crisis continues, it's important that healthcare providers quickly identify and treat a potential opioid overdose. Opioid overdose deaths can be prevented if rescuers provide basic life support care and immediately administer naloxone. Naloxone is a medication that can reverse the effects of respiratory depression caused by an opioid overdose. So that is what is going to reverse it. But you gotta know that, somebody took it. You might not know. Just like they went into cardiac arrest. A lot of times people don't know people OD'd unless they find the actual bottles or evidence that they OD'd.
Assessing the potential.
Well, let me get my other one.
I think I should try to POW real.
If you don't quit, so that you still get practice and you get to play.
I still don't quit.
You still gotta go to practice. Cause the same thing's gonna happen that happened last year. You took that off the year off and sat on the bench.
But season I'm over.
You can't keep quitting, boo.
Season I'm over.
Alright, SIN assessment can be used to identify if an opioid overdose is a possibility. So after confirming SIN safety, the following assessment can be performed. Communicate with bystanders, ask open questions such as, does anyone know what happened? Don't ask closed or yes/no type questions like, this person takes drugs. So you'll observe the victim. So you'll check for the opioid overdose triad, which is if they have a decreased level of consciousness or severe sleeplessness, like they're hard to wake up. Pinpoint eye pupils. Respiratory depression means their breathing is slow or they're not breathing at all. Next, you're going to check for other indications such as muscle spasms and needle track marks on the body. Observe the surroundings. Look for used syringes, pill bottles, pipes, or other drug-related material. So those are things to look for. That's what I'm saying. Like, especially if nobody's there to tell you what happened, you're gonna have to kind of look around to see. So they might have pill bottles, or they might have track marks in the arms, syringes, pipes, anything that look like they might be taking some type of drug. So just assessing your scene is gonna help you with figuring out if your person took some kind. Not necessarily gotta be opioids, but some kind of drug.
Treatment of potential.
All right, so a potential opioid overdose treatment during an emergency, normal BLS procedure should be followed. Perform the following additional care when the opioid overdose is expected. For a patient with suspected opioid overdose who has a definite pulse but no normal breathing or only gasping, in addition to providing rescue breathing, you're going to give naloxone. For a patient with suspected opioid overdose who has no pulse and no breathing, consider giving naloxone but do not delay CPR. For a patient with suspected opioid overdose who has a definite pulse and normal breathing, don't consider giving them naloxone and transfer it to the hospital. But you're not just gonna have, naloxone in your pocket, so unless you're somewhere that they have it.
Lesson summary. In this.
All right. Do y'all have any questions about adult BLS? Y'all think y'all got it? You said no? So it's going to be a quiz. I made the question, the time 60 seconds, so you have a minute to figure out what your answer is. I didn't make it fast. Okay.
Well, I need to look on my notes on this. So you doing the bills?
You got till 12:50 to look over your notes. So like 7 minutes or 8 minutes.
If somebody has a drug, like another type of drug that isn't opioid, do you still give them? No.
Sometimes they'll give them charcoal, like black charcoal.
But like, what if you don't know what it is?
That's why they'll give them charcoal.
Oh.
And they might not know until somebody actually sees the pills or ask. You might have to ask a family member. You know what I'm saying? Like, so you get some questions answered. Alright, so next week when y'all come back, we will do we'll start talking about pediatric BLS. Huh? Making it harder than it is.
It is hard.
One question.
I just want to, you can start it. I was looking over there. She said they don't do
Okay. You put this in on my phone? Yeah.
Those are crazy. We saw that video on Bree. Tribe Story. She did a video with Navy and
Oh,
in the third world. You saw it.
I seen it earlier. I skipped it.
And she just on that. But they money is me. Y'all should have voted in her. You got some Hawaii? No, I mean green, pink, and blue. Green, pink, and blue. That's just a boring thing over there that lying on that front desk. He said we're gonna get married.
It's a blue right here. Ain't no pink over here.
Why you being
This is a marker.
what? Oh, okay.
This.
Oh, okay. Girl, what? He said, but you want to know your I'm trying to learn to work. Backwards demonstration. I would lose my life. That bitch said she want to get on the sleeve shot.
Yes, right.
Oh,
When they be
jump.
taking folks on there, they be like,
Oh, he see that leg. But it would be me. I'll be up in the body. I'll be so embarrassed. That's like you gonna die. Like, Christ in your stomach. Miss, here, I got a question. So you know how when you get on a ride, right? And it feel like, I don't know, you know, feeling like your stomach gonna come up or something. Why does it do that? Is it something going on with your body when that happens? If you go on a ride, what you say?
Crazy for getting on it.
I'm saying like when they drop or something, and then
I guess it has something to do with like gravity and the pressure, like you going like dropping all of a sudden. I don't know what it's called.
I thought my organs were tossing.
You thought your organ was what?
I thought my organs were tossing.
What does that mean?
They're rolling around.
you feel like your stomach drop.
Yeah, I feel like your stomach.
I got 1 minute.
Me here, girl, you can start my phone.
Everybody not logged in.
Oh, right now?
Yeah.
I thought you said,
I said you got to 12:50.
yeah, it's 12:49. You got a minute.
I just said that.
Oh.
Now it's 12:50.
See you.
They don't. You'll get, I can't do it. Brown clay, I was saying, she was like, I'm pretty sure she got to do something.
I should be a brown
Or
clay.
something. Oh, wait. Huh? To take the test for the food, I mean. The brown cool, though.
When y'all playing on the computer while working here?
Brianna Max and I am Monday, Keandra Reeves, Shamari Blackman.
What?
I said, do your computer? Where you at? Where you at?
You gotta get up. You gotta come on the computer work. You gonna come on. Hurry up.
I said, no.
What is
Keandra.
You gotta
Get it right.
Get in.
That ponytail right.
Stay back here.
You heard about that water last time? What she say? What you say? Oh, okay. Oh, okay.
What I said.
What you said?
What I said.
Oh, all right.
Y'all, if y'all have to quarantine, make sure you tell your teacher so, because we don't get no list, so we don't know.
Cause today ain't getting no work.
But when I be telling my teacher,
It's too late.
they're like, still don't send work.
It would have been funny, y'all, whole team had to quarantine.
Why you being bad on us?
Y'all selfish. Well, not y'all.
How we
but-
selfish?
Not y'all.
It ain't our fault.
Your teammates selfish. I heard what one of them said when I was on quarantine. I ain't gonna miss my season because of this. Uh-huh. Sure.
Yeah, you quit last year?
No. I ain't
Or the
quit
year
last-
before?
I didn't quit my freshman year. 'Cause I started.
She played freshman year and then didn't play at all sophomore year. And then she tried to quit for like a week this year and then came back and then quit again. And wonder why she be on the bench.
When I quit for it, I quit because they don't never put me in the game. That's what I quit.
Because everybody else was at practice serving, you stand there and don't eating candy.
Maybe the coach wouldn't even done yet, so whatever. They can
Y'all so funny.
No,
Everybody
it's just
else serving,
like
you stand
I
at the
said,
door,
like
eat,
it's a thing of favoritism.
eat
Other
not your
people
bad.
mess up and they're not trying to like that. Well, I mess up. Not when I do get in the lane. So if it did back out, it's a thing of favoritism. That's why when Coach Little was here. That's why I'm going with Miriam play for her. So,
You got to sit it out of here.
they're gonna be my senior year.
You ain't gonna play. You can't play that year. You
I
got to
already
wait.
I test her for real. I would test her. I said, I might come to play with y'all next year.
You can't.
Cause my old teammates over there and my best friend sister over there. And I feel like they're business friends.
You got to sit out of here.
I don't have to, no, I don't. It's not a game. Cause I'm not coming from private school.
No, they said all empty.
If you transfer,
All empty.
If I transfer, I can sit out a game. I don't have to sit out a year.
They said a year.
no, it's usually a game. I mean a year.
Yeah, they said a year. That's why I wanted to go to.
Folks be doing stuff illegally though, but
Well, she
They
gonna do it
said
illegally
the
for me
only
to-
way
I don't know
they'll
if they
let
gonna do
you
it
sleep.
illegally now. They watching stuff.
They said the only way that you can do it is if your whole family moves, like your whole family.
What about Philo? I ain't got no tabs on me. Nobody never seen me play on that court. They don't know if I'm from
You
team
still
or
in the
not.
same system, no.
But they ain't gonna know I play the sport here though.
I snitch.
I snitch.
Anytime now. Well, wait, I log in. She already logged in. You know log in? No.
Oh.
What you trying to write me?
What you say? No,
The play get to go on me.
but not for
Oh,
me.
when I said log in now.
I'm for real though. I ain't going to live, but I'm doing flag and shit. I'm gonna stick with that.
Call it act just for like.
You heard me? Yeah.
Huh?
I'm gonna go back to flag. I'm gonna stick with that. You
What's
up?
today's up?
I'm for real.
Because a couple weeks ago, she was telling everybody how she quit the volleyball team, and then she was right back on that bench.
Because of Coach Cummings. Because of Coach Cummings, she taught my daddy. See, you don't know what happened in private. It was because I
I
can.
seen you. I kind of know. Like the day after that, you was in there talking about it. You said that after that league game. That when Coach
Yeah,
Thomas
that's
talked to your
the same
dad.
day. That's the same day.
Yeah,
I
and the
quit.
day after that, you was in there talking about how you quit. And
And
then
I
you was,
did.
and then you was there the next
And I
day.
did because
And you
trying
were
to
there the
talk to me.
next
I
day.
got messages. I came because I wanted to come back home. I don't care about y'all calling me a quitter either. Because guess what? I quit.
Shut up.
You riding dead. My seat behind is a hot pipe.
Everybody in now?
Yeah, we in here now.
Bye.